The impact of dedicated surgical specialty nursing teams to improve patient outcomes and surgeon and nursing satisfaction. We partnered with Surgical Directions and the use of their Merlin software to look at benefits of dedicated teams in the OR and understanding how those impact on patient outcomes, surgeon and nursing satisfaction, and overall efficiency in our operating room. There were four methods that we used. So one was staff identification and assignment, surgeon scorecard development, a competency maintenance, and of course our trauma service integration. The study was done to evaluate the impact of certain specialties here in our OR, which included orthopedics, urology, GYN, cardiac, spine, and robotic surgery. They focused on developing these specialized teams for improved patient outcomes, improved efficiency, and satisfaction with surgeons and nursing teams. There were four methods. We used staff identification and assignment. We had developed a surgeon scorecard. We also had competency maintenance, and we also had to implement our trauma service. We included specialties such as orthopedics, urology, GYN, cardiac, spine, and robotic surgery. We focused on developing these teams to enhance the clinical expertise within the OR and improve our patient outcomes. The data analysis we did through our Merlin software with Surgical Directions. So we used heat maps to analyze kind of peak times for surgery to optimize our staffing schedule. We also used a survey for our nurses and surgeons regarding their team preference and whether or not this was satisfactory or not. We had essentially primary teams and secondary teams. Some of the findings that were involved in this is that the nurses that were in their specialty demonstrated higher proficiency and confidence in their roles. Surgeons reported dedicated teams also increased their satisfaction and improved kind of overall patient care and OR communication. So in conclusion, we use a data-driven scheduling and surgeon scorecards and continuous feedback to ensure optimal team performance and staff satisfaction. The implemented teams for the surgical specialty were found to be significantly enhanced patient outcomes and overall efficiency and staff satisfaction. Nurse teams who maintained competency in their secondary specialties and trauma furthered our flexibility and high standards of care across our surgical services. So even though we had specialty teams that were their primary, they still had essentially a secondary team in the event their primary was not there. And of course, our trauma service line.